Hello, Enid. Thank you for joining us today for another update on COVID-19. We usually are here at 1:30 p.m. but because of the governor was online with a live feed, we waited till his was over. But today I have Ray Johnson, health educator from the Garfield County Health Department. Welcome.
Well, thanks for having me.
All right.
Like you said, I'm Ray Johnson with the Garfield County Health Department. I was here last week giving some updates, and we're going to talk a little bit today about the event that if we were to get a bunch of tests, and not saying that we have them, saying if we did, I want to stress that point, and talk about COVID-19 and how it affects children.
Yep. So I'm going to jump right in there with a question. We heard the governor mention about more test kits coming, especially for the OSU and I believe OU. Tell me something about, can you tell me about that?
Sure, yeah, of course. The first thing I want to say is just to stress that a positive test does not change the treatment. There's a national shortage of tests. So right now we need to use our tests strategically to test those that are super ill and for health workers. And in any event, a person that is given a test will still have the same treatment. There's no antibiotic, there's no vaccine, so having that positive result doesn't change the outcome. Mm-hmm. The results from the tests are used to gather data that can prevent future outbreaks and stop the spread. And just the best thing still, I just want to reiterate all these points, is implement hand washing, not touching our faces, social distancing, and staying isolated when we are sick. And if you're experiencing symptoms, to please stay home, contact your healthcare provider, and monitor those systems. And the tests will be administered to those that really need them.
Okay. A lot of our residents are wondering, is there a plan to test more people in every county and especially Garfield County?
Sure. So first, we'll talk about what the state did this week. This week they began implementing satellite testing sites. So the first sites were at Kay County and Pittsburgh County. And those were chosen by epidemiologists and state leaders. They're focusing those testing materials on counties with high cases because it's the best way to identify areas that have the potential for future outbreaks. There is no confirmation that we will be selected, and there is no date or time for when this will happen, but we are prepared to act immediately if a large number of tests were made available to us. And again, I want to reiterate that the goal of these large-scale satellite testing operations is to find and identify outbreaks, not to treat. So if we do, in the event that we do one of these, it's just to identify hotspots of the virus. And if Garfield was selected as a site, strict and specific criteria would be used to identify people that were eligible for a test. So even if we do open one, not many people would qualify, and all those requirements will be published on Facebook on the Garfield Emergency Management app. We'll partner with Enid News and Eagle to put out that criteria.
Okay.
Sorry, and then did I answer your question?
Yeah.
Okay.
I'm sure a lot of people are wondering, they know that the testing requirements are somewhat strict right now. That's probably because it's limited amount of testing kits and what have you. So the question would be, will that criteria requirement lessen or change in the near future? Will it be adjusted?
Not to my knowledge is the testing requirement going to change. Private labs, hospitals, doctors have their own testing requirements, but they are also experiencing a shortage. So they are following very similar requirements as the CDC and the Oklahoma State Department of Health, which it needs to be a severe case, they need to be elderly, they need to have some of those comorbidities like heart disease, lung disease, to be tested, and not to my knowledge are those requirements going to change.
Okay. So while the residents and the citizens in Garfield County are waiting to see whether or not we'll be tested, what can they do while they're waiting?
Yeah, so the Oklahoma State Department of Health, if you go to their website, we'll show you here in a second, they actually have a self-checker And I posted this on the Garfield County Facebook page, a link to it. You can go click on that. You see right here. So you go to the OSDH website, and then they have this symptom checker. It's a really cool tool.
Okay.
So you'll enter in your information, your symptoms, and your cell phone number, and it'll actually text you and kind of tell you what to do next. Like, you can text it, and it'll say, stay home, monitor your symptoms, and how to proceed from there.
Okay.
And it also is a great tool to gather data for the state.
So another question would be, a lot of our residents are wondering, where will they be able to go to get the testing for COVID-19?
So as far as tests that are coming from the state go, if we were to hold one of these satellite testing events, we would have a drive-through event, and it would be here in Garfield County at a location,
Okay.
at a predetermined location. And that before that was we would advertise through Facebook. Garfield E&M would probably connect with you all and have you guys advertise to let people know that was coming. And we're working on a way to have people do that criteria before, so they don't get there and then get turned away.
Okay. And the event, I imagine, when and if a vaccine is made, where would that be? Where would residents here go to receive that treatment?
So one of the things that the health department really excels at is administering vaccine to the community on a large scale. This is something we train for all the time. So say we were to get a vaccine, we would hold a pod, and it would be either a drive-through, walk-through event where people would come and we would do mass vaccine all at one time. We're actually preparing for if we were to get tests, not saying that we have them or that we are going to, but if we're going to kind of employ those same procedures and practices that we do for vaccines for the testing. But that's something that we're really good at, and we are prepared if we get a vaccine. But again, that's 12 to 18 months down the road.
Okay.
So, sorry.
Go ahead.
What's really important to remember is that we're social distancing, we're staying home, we're isolating our sick, we're hand washing, because there are really smart people out there that are working to create a vaccine, to create treatments, but we need to buy them time. So we need to not overwhelm our healthcare system and stay home, so then we have better outcomes.
Okay. Can you give me a general update on what Garfield County and the world has learned more about COVID-19?
So COVID-19 is a rapidly changing virus. It's brand new. New information is coming out every hour. As of this morning, we had 322 positive test results in the state. 105 people are hospitalized, and we have had 8 deaths. New counties today that are now popping up for cases are Cato, Cherokee, Choctaw, Latimer, and Pittsburgh counties. You can follow this tool here he's showing. This is the CDC website that can show you the cases in the United States. Actually, if you click on each state, it will take you to their state department, health department website, and then you can see, and that's ours. We have an entire section. This is the Oklahoma State Department of Health, but the Garfield one also will take you to the same COVID information. Let's see. So I just want to talk one more thing about those satellite testing sites. So those are being used to gather data. So the epidemiologists do those testing sites, and then the data is gathered, and then that is kind of determined where hotspots are and, how to progress through it. So that kind of determines additional sites opening, and as soon as we get information on that, we will be in contact and let you guys know.
Okay. So I think many people, some really do know what a virus is, and some may still not really understand what that is. Can you kind of tell us what a virus really is?
Sure. So most illnesses come from either a bacteria or from a virus. Bacterial illnesses and viruses are just different types of germs. They're very tiny, and when they get inside your body, they can make you sick. So typical viruses are colds, chickenpox, measles, flu, and many other diseases that cannot be treated with antibiotics. Usually there's a virus a vaccine. And then bacterial illnesses would be like staph, strep throat, UTIs, and those can be treated with antibiotics. So coronavirus, COVID-19 is a virus. It is not treatable with antibiotics. You just basically treat the symptoms, and there is no vaccine.
Okay. Now let's talk about our kids, because people are really concerned about the kids. They're at home now. School is basically going to be online. Can you tell me, are children 100% safe from the COVID-19, and why are schools closed?
Sure. Yeah, I have little kids, so I'm, always watching. I'm always really worried about the flu, because the flu, there are a lot of pediatric cases and sometimes poor outcomes from the flu. So I'm always really worried about that because I have children. But asking if children are 100% safe from COVID-19, they're not. No one is. It's a brand new virus. We have no immunity in our community, so everyone can get it. But another important thing is that 80% of the people that get this virus are going to have mild symptoms and are going to be able to stay at home and will be okay. But going back to the children, early research is suggesting that for kids it's really mild symptoms. Yeah, and then, sorry, go ahead.
I was about to say, are the symptoms different from child to child? I mean,
no, we're not seeing, they're milder in children, so they're less severe, but everyone, as far as we can tell, experience the same symptoms, which is the fever, cough, shortness of breath, but in children it would be more mild. And the reason that schools are closing, one is because schools are a place where schools, businesses, places where a lot of people are where viruses spread. So the schools are closing not only to protect the children, but to protect the staff, protect the children from bringing viruses home to their family, to their elderly staff that could be immunocompromised or have some of these health concerns, or family members that could have it. So It's important that we really activate all of these social distancing and keeping gatherings to little to nothing to prevent the spread, so we can buy some time.
Okay. Can you tell me, what can parents do to minimize the risks of COVID-19?
Those are the same things we're talking about. Everything. You clean your hands often. Avoid people who are sick. One tip for kids is while they're washing their hands, they can sing the ABCs, so that gives you that full 20 seconds of washing your hands. Clean and disinfect high-touch surfaces frequently, so that's your doorknobs, countertops, any hard surfaces that get a lot of traffic. You can launder your items. A question that we've been asked is, if someone is sick, can you wash their clothes with healthy people's clothes? And yes, you can. It's suggested at a high temperature if possible.
Okay.
And then practice that social distancing, revise travel plans, and right now we're suggesting, unless it's essential, don't travel. Traveling is a great way to spread viruses. And if children meet outside, outside is what we're encouraging, but if they're meeting in bigger groups, they're still spreading the virus. And it's really important to remember to have children limit time with older adults or people that have some of those pre-existing conditions we have talked about.
Okay. What can parents do if a child feels sick, and how can they care for a child that has COVID-19?
Sure. It's the same as with anyone. They would stay at home and monitor those symptoms. If a mask is available, you have the child wear a mask and the caregiver would wear a mask. Clean those surfaces. Any utensils that the child uses, make sure they're getting clean just to prevent it from spreading. But again, in children, it's typically a pretty mild illness, so they would need to be isolated and then just taken care of like you would any other illness, because it is just another virus. We're just having some poor outcomes in different populations.
So would it be wise, or is it suggested, to separate those that are not sick and sick? For instance,
Yes.
You have a family of 6 or what have you.
Yeah, and that's really hard to do with families. It's really hard to, especially with little kids, you can't keep them separate, but you want to do your best to isolate the sick, have them use a separate bathroom, clean anything that they have touched or coughed or used as much as you can.
Okay. So when it comes to face masks, and let's say you have a family of 6 and one of the kids is sick, the rest of them aren't, should still all 6 of them wear a face mask? Who should wear the face mask? Who should?
So this face mask should be saved for the sick and for our healthcare workers. Excuse me. And the person that's caring for the child should use the face mask if possible, and just try to keep that social distancing. So not necessarily everyone.
Okay.
Yeah, sorry, go ahead.
Okay.
Sorry.
Here's another question. What are things that parents need to monitor? And I want you to tell me as far as their health, as far as dealing with the media, because, kids they're at home, so they're going to be watching TV.
Sure.
And, some things of this nature, pandemics can give kids anxiety. So I kind of want to know how do parents need to deal with all of that?
Sure. So we'll break it down. We'll talk about health-wise, media, and signs of anxiety. So health-wise, really important for that children still get their daily exercise. The CDC recommends that kiddos get 60 minutes a day and 30 minutes for an adult. So we're encouraging people to play outside, go on a walk, go on a bike ride. And especially with the weather getting nice, it's a great opportunity to get outside, still practice that social distancing, but get some exercise, use indoor activity breaks if we aren't having such great weather, and we can still reach out to friends and family over the phone, video chats. We had some suggestions to write cards or letters to family members, which I think is great. But still just remembering to eat healthy and get that activity because it helps everybody that's feeling really cooped up. And there are some resources posted on the Garfield County Facebook page for some tips and talking points for parents and their kids.
Okay.
And as far as the media, this is for everybody. It's not helping us to watch constantly the news, the national news about the virus. You need to stick to your daily update if you need it, and your local information. So here's a great resource, Garfield County Facebook page, the Garfield Emergency Management app. They're all giving credible information, and it's information that you need to know, and then turn it off and find something else to do, because that's what causes the anxiety when we're spending all that time just staring at the same thing, and I'm really, really bad about that myself. And then anxiety, so things to look out for in kids and other people, excessive worry or sadness, and unhealthy eating or sleeping habits, difficulty with attention and concentration, and the CDC provides some results for that, or some resources for that. There's a mental health helpline that the OSDH provides, and if you visit the Garfield County Facebook page, there's some resources posted for kids.
Okay. So there is materials that parents can have to talk to their children?
Yeah, and the CDC has a great resource, and I think that's posted on the Facebook page that gives some talking points to talk with kids. It's important to be honest and just give, for kids to have a trusted person that they can talk to about it, because it is scary and they're hearing a lot of stuff, but be reassuring, be honest, tell them that you don't know. They have some great talking points on there.
Okay. So if anyone, our viewers, wants to be updated with everything that's going on in Garfield County, what's their go-to page or phone number or what have you?
Okay, so we have the Garfield County Health Department Facebook page. We're sending out emergency updates and case updates to the Garfield Emergency Management app. The OSDH website is great, the CDC website, and then there is the 1-800 number. There's a 24-hour hotline that people can call for resources about COVID-19, or they can dial 211. And now that self-checker is another good one.
Okay. Well, is there anything else you think you should add, or?
Not that I think so. Just to remember to really practice the social distancing. I know it's hard, and I know it's asking a lot, but it's really important to protect those people, the elderly and the people with pre-existing illnesses. One more thing that I do want to add is I know we're getting a lot of questions about tests in Garfield County, and a positive test isn't going to change a lot for what we're doing. It's important to practice all of these things, and we're being very prudent about the social distancing and about how we're, conducting business because we're trying to lessen the stress on the healthcare system.
Okay. Each doctor, I imagine, here is independent. There's no big number you can say we have this many tests in it because they're all independent.
They're independent, yeah. They're private, and also we have in healthcare. There's HIPAA, and you have to protect patients. We can't say, oh, Mary Jo has a pending test. We don't have results back. It's unethical to share that information.
Yeah, because many people, not only in the Enid but across the world, don't understand that there are laws for HIPAA.
There's laws for HIPAA. You can't reveal patient information, and there are multiple private labs, and there's the state lab, so we can't say who is testing and who is not, and what is pending.
But the private labs, I imagine, have to send their results to the state?
Yes, they do.
Okay.
Yeah.
Okay.
And that comes to the state office.
Okay. Well, I appreciate the information.
Yeah.
And thank you, Ray.
Yeah.
Ray or maybe another guest, maybe Maggie, will be here on Fridays to update us weekly at 1:30, unless the governor or the president is on at that time. But 1:30 is the go-to time, Monday through Friday, to get community updates from the city. We're going to take a break here, and we'll be back. I want you to stay online. The mayor will come back, and he has a message for the community. So see you in a bit.
Good afternoon, Enid. I'm Mayor Pankinen, and I want to update you on the actions the city is taking to further protect its citizens from the advancing threat of COVID-19. Effective Saturday, March 28th at 11:59 p.m., we will implement all of the restrictions ordered by Governor Stitt for the counties that have received a positive COVID test. Also, the restrictions made in our earlier declarations remain in effect until April 16th. This date aligns with the declaration on the date of the governor's executive order. I understand that these actions are economically difficult for many businesses, especially the small business population that provides the charm that our city is so well known for. But there is help coming. Most households will receive $1,200 per adult and $500 per child from the stimulus bill, which was passed by the U.S. Senate unanimously yesterday and was passed today by the House of Representatives with a promise from President Trump that it will be signed. Workers that are laid off will not need to wait the normal 1 week to receive unemployment benefits, and self-employed people will actually be allowed to apply for these benefits. Some businesses can obtain low-interest loans if they need financial help. These loans may even be forgiven if they're used to pay for employee wages or certain other company financial obligations. So there is help coming. There is help here, and there is more help coming. Many people have asked me, what can I do to help? This question demonstrates what I love about Enid, Oklahoma. We all care about each other. In the last week, I've seen how businesses have innovated their business practices to make us all safer. I got a flat tire Wednesday. I stopped by the nearest tire repair business to my home. It was just prior to them opening up, but I saw every employee cleaning off all the computer equipment, all the chairs, all the tables, mopping the showroom floor. When I entered, I was asked to drive my car into the first bay. They explained that this would protect their workers from contaminants in my car and prevent their workers from leaving contaminants inside of the vehicle that I would be exposed to. A great example of how we find small ways to modify our daily business operations that protect us all. I'd like to ask everyone at your normal routine to look at your normal routine and see how you can change it to make us all safer. Please use pickup or delivery service to the maximum extent possible. Need gas? Pay at the pump. You need groceries? Call in your order ahead and do the curbside pickup. If you need to go to a business, go alone. Bringing additional family members greatly multiplies the risk of exposure to us all. Like to get your exercise by walking around? Do it individually or in small family groups in your neighborhood or on the Enid Trail system, not in places of business where people are exposed. We've made it through many devastating events, but nothing quite like this. What I know is that we will make it through this difficult time. Please watch out for your families and for the vulnerable neighbors in your neighborhood. Let's look out for each other, and we will get through this. If you have any questions, please go ahead and text them in or reply to the make post to this broadcast. And Monday at 1:30 we'll meet again and we'll try to answer those questions. With your help, we're going to get by this tragedy. Thank you, Enid. Stay strong.